Good morning, everyone, and welcome to this month's Housing Our Future webinar. We're happy to have you here today. We're going to be talking about the intersection of health and housing, and we have an excellent panel to really share some important information and knowledge with you from several locations around the country. So thank you for being here. Just a couple quick housekeeping items. All of you as guests to the webinar are muted. So if you have questions, we would love to have those shared in the chat with our host, and we will funnel those to Kiana, our moderator, at the end of the session for discussion. This session is also being recorded and will be made available on our website at the once we're able to kind of get everything organized and downloaded. And yes, please absolutely share questions, comments with us. We want this, we know interactive is hard in this setting, but we want to try and make sure that we are responding to the queries that you have. So please share those. And at the end, this time, we haven't done this before, we're going to take it for a test ride to share opportunity for us to have a little after presentation discussion. So if you'd like to stay for that, please do, and we will move into that kind of format at the end of our formal part of the session. So with that, I'm going to introduce Kiana Trabue, who will be our moderator for this session. Kiana.
Thank you so much, Kristen, and good morning, everyone. I'm very excited to have this discussion with you all today. Looking forward to hearing from our awesome panelists, hearing some of the work that they're doing around housing and health. As Kristen mentioned, my name is Kiana Trabue. I currently serve as Vice President of Strategic Partnerships for BI3, which is a grant-making initiative of Bethesda, Inc. In that work, I work with our strategic partner, which is TriHealth, and other community partners to co-design innovative initiatives to improve health and healthcare here in Greater Cincinnati. BI3 is also very proud to be the founding sponsor of Housing Our Future, and very proud of the work that has been done thus far. So before we get started with our panelists, I do want to just take a little bit of time to frame our discussion this morning and really thinking about housing as a social determinant of health, and then understanding the 4 pathways that really connect health and housing. So as a refresher for many of you, I'm sure, social determinants of health are the economic and social conditions that influence both individual and group differences in health status. Researchers believe that social determinants of health drive up to 80% of an individual's health status. And so that means clinical or medical care alone only drives about 20% of health status. And that also means that clinical care by itself is insufficient to improve health. So if we really want to improve health, we have to have both that clinical and medical care, as well as work to address the social determinants of health. According to a recent report from the Health Policy Institute of Ohio, stable, affordable, and safe housing is really critical for good health. Things like high housing costs and poor housing quality contribute to very toxic stress that can lead to negative health outcomes. The more affordable housing that a community has, the more individuals are able to save that money and pay for other necessities like healthcare and healthy food. So addressing housing issues really has been proven to improve birth outcomes, reduce infant mortality disparities, and just improve health overall. Thinking about the 4 pathways that connect housing and health, as I mentioned before, one is just housing stability. The other is the quality of housing and the safety of housing. That means the safety of the place where individuals live, as in the physical structure, but then also that environment around them. Affordability. So again, making sure that rental costs and mortgage costs are staying relatively low so that individuals have more income to spend on other necessities. And then also neighborhood. So where people live, how safe it is, the proximity to healthcare access resources, as well as things like grocery stores and other amenities in a neighborhood, also have a great impact on health. I do also want to share a little bit of the work of some of our BI3 partners. One is around Cradle Cincinnati and their partnership with the Cincinnati Metropolitan Housing Authority that gives pregnant women quick access to housing vouchers, which gets them into that stable housing, which will help improve their birth outcomes. In addition, Cradle was recently awarded a planning grant for the Healthy Beginnings at Home project from CareSource. And so we have a friend from CareSource with us today that may share some additional details about that project. Another example is the Maternal Health Law Partnership, or MHELP. That's a partnership between Legal Aid of Cincinnati and Good Samaritan Hospital's OB-GYN clinic to address women's health-harming legal needs before they give birth. What we found is one of the main areas where women need help and advocacy is around housing. So lots of success happening with some of our partners, and I'd be remiss if I did not mention that. All right, now we're gonna move on, and I'll have a moment for our panelists to introduce themselves to you. The first panelist I'll call on is George. If you wanna unmute and introduce yourself.
Certainly, thank you, Kiana. Good morning, everyone. My name is George Kleb, and I am Director of Housing and Community Development for Bon Secours Mercy Health. We are a Catholic-sponsored health system that does work in 7 states and also in Ireland. In my work, I'm responsible for the development and operations of housing at our Baltimore market. We're an affordable housing developer and operator there. I also work on capital projects for neighborhood improvements, such as parks, open space projects, also community service facilities, and then finally community engagement activities, which we'll probably delve into a little later in our discussion. At the system level, I'm part of the team that works on strategies to integrate housing and other social determinants of health interventions into how we provide services as part of the Community Health Division.
Great, thanks so much, Greg. All right, next we'll hear from Gretchen.
Thank you, Kiana. Hello and good morning. My name is Gretchen West, and I'm the Executive Director of Healthy Homes in Columbus, Ohio. Healthy Homes is a nonprofit housing organization and partnership established in 2008 between Nationwide Children's Hospital and our local community development corporation, Community Development for All People. We have 3 main programs. So we provide exterior home improvement grants to low-income owner-occupied properties and small landlords. We build or rehab housing for affordable home ownership opportunities. And as of 2017, we started building or rehabbing homes for affordable rental opportunities. We've been doing this work for over a decade, and there's no doubt in my mind the benefits of our initiative on the residents are significant. So happy to be here and looking forward to the discussion. Thank you.
Thank you, Gretchen. Next, we'll have Diane.
Good morning, everybody. My name is Diane Alecusan. I am the Social Determinants of Health Strategy Lead for Housing for CareSource's Ohio market. CareSource, if you are not aware, we are a managed care organization. We only work with government-sponsored healthcare, so Medicaid, Medicare Advantage, the healthcare marketplace. And right now we cover 5, maybe 6 now states, expanding as we speak. And we have about 1.3 million Medicaid members throughout the state of Ohio. CareSource is a nonprofit, so we really like to emphasize people over profit. And as a managed care organization, we come at things a little bit differently in this space, since we're not a hospital. We don't have just kind of a certain geographic focus. We work very closely with hospitals and health providers, all to help the health and well-being of the members that we serve. So my position is I am new, and my position itself is very new. So I've been with CareSource for about 2 months now. In my position as the housing person for our Ohio market is a brand new position too. So this is something that we're definitely growing in. We do have a social determinants of health focused team that we've had for several years now that we call Life Services. But our housing pillar is fairly new. So we're really trying to do everything we can to figure out where we can have the most impact, where we can fill those gaps. And really seeing housing as that healthcare intervention. So yeah, thank you for having me and looking forward to the conversation.
Thank you so much. Lastly, I do want to acknowledge we had one panelist, Kendra Smith, who's Vice President of Community Health for Secours Mercy Health, who is unfortunately unable to join us this morning at the last minute. So we just want to send some positive vibes her way. All right, so let's go ahead and dig into the discussion. I'm really, really excited to hear from all of you. So our first topic is really just kind of around establishing the connection between health and housing. So what connection do you see between health and housing in your work? And feel free to just jump in whenever you're ready to talk.
Well, I'll start. You know, at Secours Mercy, there are multiple points of connection, and I think, you know, Kiana, you gave a very good overview of, you know, how in the context of social determinants of health and the importance, you know, of a person's social condition, so to speak, you know, in their health outcomes. So that almost, it doesn't go without saying, but it's also one of those sort of obvious connections that has been right in front of both industries, housing and health, for as long as they've existed. But now we're just kind of having this aha moment. But for us, there's sort of three areas where we make the connection. You know, first is in advocacy. Housing advocacy and healthcare advocacy can come together and really work at the state, local, and national policy levels to create conditions where housing can be provided in a very affordable way. Then there would be financing and funding. Although you know, for example, there's been a lot of attention paid to how community benefit can be redirected towards housing and other social determinants work, and that is a very important sort of pathway to explore. But you know, both housing and healthcare are very capital intensive industries, and so when we can join together and help to fund important projects, there's an opportunity to leverage. Now, the housing issues that we have in this country can't be solved just by healthcare getting involved, but there is that opportunity for leverage and partnership, and sometimes healthcare can bring some other partners in. And then so there's, you know, there's the advocacy, there's the financing and funding, and then finally there's the direct services. And you know, for example, we provide housing development and operations, you know, affordable housing directly in our Baltimore market, and in Cincinnati we're providing foreclosure prevention and eviction prevention. But that varies, you know, from market to market. Every community is different, and so that connection of like we as a healthcare provider, especially when we're providing acute and ambulatory care, we're already present in these communities, and so we have a unique opportunity to do things like perform screens for social determinants, you know, in the emergency room and in ambulatory settings. But those are just some examples of how we can make the connection.
That's great. I love that you mentioned advocacy as one thing, and I'll put a pin in that and come back to that later. Thank you. Diane, it looked like you wanted to chime in there.
Sure. So this one is an interesting one for me, since I am newer to CareSource and the healthcare part of this. My previous role was working with the Ohio Housing Finance Agency, and I was there for about 4.5 years, and overseeing the policy development for the multifamily rental housing for the state of Ohio, primarily low-income housing tax credits, but also all the other funding sources, state and federal level, that we were administering. So, you know, in that role, that connection was much more indirect, but it was definitely something that in the housing world, you know, we had to focus on what policies we put in place to, you know, ensure that residents of those properties that we fund, you know, are, you know, poised for healthy lifestyles, you know, are supported in their needs. And so, you know, whether that was where we site projects, you know, proximity to certain things or having healthy or green design features in the actual, units and buildings. That was the angle there. Now that I'm at CareSource, the connection is so much more direct, right? And that's exciting because I didn't get to have that very individual focus, specific individual or family focus before. But now, we know that access to housing, access to quality housing, affordable housing has a direct impact on our members because we can see it in the data. I think in the housing space, you really don't have that ability to see those things. There are a lot of partnerships, but it's a challenge. So there's such a huge opportunity and benefit on this side to be able to see the actual data and to see, what the before and after was from a specific housing intervention. So that's really exciting. And I think for me, that's kind of what's standing out now is like, how do we take advantage of that and keep building upon that? Doing more data collection, analysis, geospatial intel, that's really going to pull it all together. So I think for me, that's really, seeing that connection with that direct member data is, about as clear as you can get, right? That's exciting.
Absolutely. Thank you so much. So Gretchen, what connections are you seeing between, Gretchen, what connections are you seeing between health and housing in your work?
So really similar to Diane, I think we see the biggest connection in our low to moderate income rental housing. So right now we have 74 units in service and we're constantly adding new units. Our average rent is $470 less than Columbus's median rent. And so as you might expect with a scattered site, mostly single family portfolio, we're serving mostly families. And of course, that's by design because we're associated with a children's hospital. But beyond offering below market rate affordable rental units, we're of course building these units or rehabbing them to a high standard so that they're healthy for the residents to live in. But most importantly, in my opinion, and this sort of goes back to what you were saying at the beginning, we are constantly looking at ways to provide stability. And so, for example, at the outset of COVID lockdown, we made the immediate decisions that evictions were off the table. We waived late fees. We were sending weekly notices to our tenants about food assistance, utility assistance, rental assistance. And then we raised our own money to match with our local community action agency. And that $20,000 kept everyone in our portfolio housed until the end of the year. And so we really work to try to avoid evictions at all costs. It's not always successful, but it's extremely important to me that at least through COVID, especially, like there wasn't that added stress of not having a place to live and that we were going to provide that stability through that time frame.
That's great. It sounds like you guys are doing some really great work in Columbus and some things that we could learn from and leverage here in Cincinnati. One of the things that you brought up, I thought we could spend a little time digging into. You talked about the effect of COVID around housing. So can you share a little bit more detail about how you saw that impact housing in particular?
Sure. So as you might expect, renting to low to moderate income folks, we had about 15% of our portfolio who lost their jobs and were unable to pay rent. But it also increased the amount of people looking for housing. Our waiting list went from 3 to like 18 within a couple of months. And it's also because people weren't vacating. So we had really low turnover during that time because if you had housing, it was top of mind for people to hold on to that housing. And so we're still dealing with the effects here in Columbus. Housing, especially affordable housing, is extremely hard to come by and our wait list grows every day, especially as the real estate market itself is white hot right now in Columbus. And every day we're fielding phone calls from folks, hey, I just got a 30-day notice from my landlord because he can sell this house for a lot more than it was originally worth. And so lots of people are being pushed out of their current housing now. And so we have to develop the policies to solve that. And we also have to start building more.
Absolutely. Thank you so much for sharing that. I'm pretty sure you've seen similar things as well, George, in the work of Bon Secours Mercy Health as it relates to COVID. Can you talk a little bit about that?
Oh, most definitely. I was really piqued my interest when Gretchen said 15%, because that's exactly the numbers we have for our family housing. We have a little over 800 units of housing, affordable rental, but little over 270 are family housing. And in our family housing, we had 15% of the folks directly affected economically by COVID, whether it was a loss of a job or a decrease in income, because these are households, might not have been every member of the family. And what we found was that, number one, in our community, and I know in a lot of communities across the country, there was a great emphasis in both the private and the public funding world on eviction prevention. And we were fortunate that we already had a bit of an infrastructure to prevent evictions. In fact, that's a metric that we've been following for a while prior to the pandemic. And our eviction rates are about a third of the rate in the general Baltimore city market. So we'd already put a service enriched environment together. And we work with a third-party management company, but we have service coordinators that are employed by Bon Secours and are connected to the programs and services that we provide at our sister agency. It's called Community Works, which has an eviction prevention program. So we were able to leverage a lot more dollars. And of course, we already had low eviction rates, and we were, of course, like everyone else, we didn't evict anybody, during the pandemic, and still haven't. But the backlog that Gretchen described, maybe for different reasons in Baltimore, but yeah, our waiting lists and the calls that we get for housing assistance have dramatically increased, probably by about 150%. We actually had to pull one of the service coordinators and reconfigure our staffing to have the service coordinator spend most of her time taking calls for housing assistance. So that was a new thing for us. I mean, I think we're going to be dealing with that for many, many years to come, because also, as everybody's experienced, production is slowed down, and now when we're trying to pick it back up again, building costs have dramatically increased. So, it's a dynamic of a kind of perfect storm. The good news is that I'd rather not have had a global pandemic to get this attention to the issue, but a lot of folks in a number of different industries, not just health and housing, are now focused on this, because this is an issue for employers. Stability. If the folks you're employing don't have a stable place to live, it's very hard to get them to be able to come to work and be productive, for example.
Right. Yeah, we're going to touch on that a little bit later as well. Thanks for sharing that. Diane, thinking about, I know that you've only been in your position with CareSource for about 2 months, but thinking about your previous role and COVID, what impact did you see?
We at OFA, I'm sorry, I still say we, this, new job, it takes a while to transition over there, but, OFA saw it from the impacts from a variety of different perspectives, which was interesting to see, but also try to figure out the different solutions for each of those areas. So, for example, we were hearing about, the residents losing their jobs, having threats in that sense on that individual resident tenant level, while also, the property owners that we were working with struggling to, in some cases, I know we had seen many senior properties that were coming online and they were not getting leased up. In these places that have a huge need for affordable housing, but senior properties were not getting leased up because seniors did not want to move. It was, a health risk. So then those property owners, were not getting the rents that they needed to sustain themselves. So, and investors, weren't getting some of their money. So it was coming at us from lots of different angles. And I think too, there was just, and there is still so much money from federal government, the state government coming in. So, we were trying to figure out, okay, what can we do specifically at OFA? And, along with George's point about just rising construction costs, I know that's something that they're still working on. So what could they do specifically at OFA, but also, how do we just get all this information out to make sure that all of our property owners are aware, they're communicating to their tenants. There's just been so much money and so much information, we need to make sure that these residents know that they can't be evicted or know that they can access rental assistance. And that, was and still remains a huge challenge. So I think there's, been impacts everywhere, and we're all still kind of trying to figure out how to best put it together and ensure that recovery for everyone.
Yeah, thanks so much for sharing that. I think we're going to continue to feel the impacts of COVID for a very long time, unfortunately. One thing that you touched on very briefly, Diane, earlier in your comments, thinking about the properties through your previous role and talking about making sure your policies were people friendly and talking about green space and things like that. One thing we didn't necessarily touch on that I'd like to jump into right now for just a bit is thinking about environmental impacts on that are focused around housing and how that impacts an individual's health outcomes. So thinking of things like air pollution and lead paint, mold in homes and things like that. Can you touch a little bit about how you're seeing any connections there or any experiences that you've had in your previous role?
Yeah, definitely. This is something that's a huge priority for us at CareSource, but it's also a huge priority for our governor right now, especially with children's health and lead poisoning specifically. So we kind of from a higher level have put a number of financial investments into funding for these initiatives. So the biggest one has been so far the Lead Safe Cleveland initiative. Cleveland is doing some really, groundbreaking things in terms of lead remediation and prevention. So they have a lead safe, I think it's an ordinance right now. So the rental properties built before 1978 now have to get a lead safe certification, not necessarily lead free, but lead safe certification. So obviously this is a huge lift for many different entities, but the city of Cleveland and their partners have been amazing in just the communications that they've been getting out. But CareSource's investment is going into that fund, which is going to help with the costs of the testing, the remediation of these properties, or just the lead safe practices to make them lead safe, because we know that not all property owners and landlords have the extra funds to comply with this new ordinance. So our priority is really to make sure that this housing is lead free, so that we're preventing lead poisoning. There's been a lot of focus on once a child tests positive, but we really need to make sure we're also nipping it in the bud and preventing these things from happening first too. So this is a really big step, and the project initiative is just getting started. So we're excited to see the results of that, and start tracking, our members' health outcomes as well as just the overall change in health outcomes that the city sees over the next few years.
Great. Thank you so much. I mean, we could spend all morning talking about just that, but we do need to move on and talk about some other things. So let's shift gears a little bit. Each of you talked about some very specific housing interventions that your respective organizations have implemented. So can you talk a little bit more specifically and share some examples of housing interventions that have positively impacted health outcomes, but then also healthcare costs? So as you know, we continue to see health outcomes decrease and become poorer and poorer, but we also see healthcare costs continue to rise. So can you talk about some specific interventions that have resulted in improved health outcomes and lower healthcare costs?
So I can go first. So if we're talking just about our rental portfolio, while we're supposed to be serving families up to 80% of area median income, which in Columbus is roughly $67,000 for a family of 4. Because we accept Section 8 vouchers, we're serving families at a much lower level. So our average family makes $29,000 a year, has 2 children, and is headed by a single parent. And so our rental portfolio is really giving us the biggest opportunity to influence the health of Medicaid children for the hospital, which they cover through their accountable care organization by the name of Partners for Kids. So as an ACO, Partners for Kids is responsible for the health care of up to, I think it's just over 330 children right now throughout Ohio. And PFK gets paid on a capitation rate. So when children are healthy and they stay healthy, there's a cost savings for the hospital. In 2020, early 2020, right before COVID shut down, our researchers published a study and they compared our impact area with 2 demographically similar impact areas in Columbus. And they found that there were greater decreases in inpatient stays for children and emergency room visits. But I have to note that the differences were rather small. So I always like to point out that decades and decades of disinvestment caused by racial redlining isn't going to be solved in a short amount of time. So I think this data is really important to understand that there is a difference and we're working towards an end goal, but it also underscores the importance of continuing to do the work.
Thank you so much. And I'm so glad you brought up that point, because oftentimes when we talk about these things and we talk about measuring progress and success and impact, people expect things immediately. And we know, to your point, it takes a long time to undo what's been done and kind of right those wrongs. So I'm glad that you mentioned that. One other thing, I know that in the public health and healthcare space, we love acronyms. And so you mentioned ACO. Can you explain what that is for those on the call that may not know what that is?
So ACO, Accountable Care Organization. So we're responsible for the care of children who are on Medicaid in Central Ohio and parts of Southeastern Ohio. So if that child has Medicaid, it's covered by the hospital. They go to get care. It's those costs are covered by Medicaid payments to the ACO.
Thank you so much. So George and Diane, do you have specific interventions you can talk about that resulted in improved health outcomes and decreased healthcare costs?
Well, I can't speak to I can speak to the cost from a different kind of angle. I mentioned leverage before. Our housing interventions have been really more from the standpoint of community health rather than clinical health care. So one way to look at it is we're trying to create the conditions for good health. And, as you and Gretchen noted, I mean, the conditions became the way they are over multiple decades. And so the returns on that are going to take some time. Having said that, what we've been able to do is through a partnership with Johns Hopkins Kluger School of Public Health, we conducted a social return on investment analysis of our housing portfolio a couple years ago. And what we found was discounting services folks would already have received and trying to take sort of a conservative approach. Every dollar that was spent in our housing operations leveraged close to $2, $1.92 in services that folks wouldn't have been able to access. Now that included some healthcare access, but it was all blended in. And the point behind that is that the stability and the quality of the housing, it's not just the stability, it's also the quality of, lead-free is something we've talked about already, but also, when you have a quality landlord and when you have an issue in your house, it actually gets taken care of, when your roof doesn't leak, when your air conditioning and heating works, all those kind of things, you have the ability to access services that you would otherwise not have been able to access. The idea is that actually frees up access and frankly dollars that we would have had to create another program if we weren't doing the housing to help people access other things. So, the returns are early, and we've been at this in Baltimore since the mid '90s, but we just haven't. Some other systems have focused on particular populations, such as folks who are formerly homeless with chronic conditions, but we haven't focused on that in our work.
Thank you so much. Such great things happening. Diane, can you talk a little bit about CareSource's programs and what the data is showing you?
Yeah, so, we're still fairly young in our housing work, like I mentioned, but I will talk a little bit about the program, pilot, initiative, whatever you want to call it, that has probably been the biggest and most prominent, and that you, Kiana, mentioned or alluded to earlier, that we have some new partnerships with this, but it's the Healthy Beginnings at Home program. So this was, it's a research pilot that CareSource has been a part of for the past several years. And the pilot was in collaboration with Celebrate One from the City of Columbus, Columbus Metropolitan Housing Authority, the Homeless Families Foundation, and other partners. And the idea was really, can the provision of safe, affordable housing during pregnancy improve health outcomes, both birth, maternal, and infant, and reduce infant mortality? So that is really the core question. And, seeing if and showing that housing as the health intervention, can have those impacts. So the pilot itself was 100 women, 50 in an intervention group, 50 in a control group. But after the provision of housing, along with housing assistance, medical care, social supports, the research has shown, some of the key figures that I'll point out are, babies who are born at full term and healthy birth weight. The control group was 24, and the intervention group was 40. So, these are, we do have to say, they are not, in the research world, these are not statistically significant yet, because the research group, the participants, were not, we only had, 100. So I do have to say that, but that is part of why we're working right now to hopefully replicate this effort throughout the state of Ohio. We're currently working with Cradle Cincinnati and closely following some money in the state budget that will hopefully come through so that we can replicate this in other cities in Ohio. And we've also at CareSource received interest in this from the state of Indiana, the state of Georgia. We actually have a call with HUD and HHS at the end of the month, who've also expressed interest, which is really exciting. But yeah, a couple of the other data points that I think are really telling. The the average duration of stay in the NICU was reduced by 72% between the control and intervention group. Newborns placed in the NICU were reduced by 60%. Length of stay for sick newborns in the intervention group was 8 days compared to 29 days in the control group. So we really did see, I will say significant, but not statistically, but significant outcomes that said, yes, we need to keep pursuing this path. We need to keep growing this so that we can get to that point of showing that this is statistically significant, with the end goal of hopefully changing policy, right? That's the end goal, is to change policy, to maybe get some of these things more integrated into the housing and healthcare systems. So that's the kind of big project that I think most people know about that's still ongoing. So fingers crossed for funding in the budget.
That is great. I think that those results are amazing. And I think what you described is exactly what needs to happen. You start with a small pilot and you do a demonstration project and you prove that it works. And then you move to scale that so that you can see greater impact. You also gave us a perfect segue into the next topic, which is around policy implications. So you talked a little bit about wanting, the end goal wanting to influence policy and then also get those dollars in the budget to support these kinds of things. So as we think about the policy implications, thinking about so many people have roles to play in improving housing conditions. Thinking about healthcare systems, which are represented here, the business community, government entities, policymakers, community-based organizations, foundations, managed care organizations, and insurance companies. So can you all talk a little bit about what impact can each of these players have at the local level when it comes to making some of these programs and interventions sustainable and moving them to scale?
I'll try my best to answer that question. So I think hospitals and healthcare systems, either as like anchor organizations or place-based economic powerhouses, just because of their sheer size and number of employees, have the opportunity to make investments and to improve community health. And so the hospitals have access to so many resources. So like it could be an endowment, a capital budget. They have real estate financing expertise or significant real estate holdings. All of these could be put to work to create an affordable housing strategy. And I know today is just primarily focused on housing, but there's also much to be said about the decisions hospitals can make in terms of purchasing power and hiring practices that could also uplift communities.
Can you talk a little bit more about when you say hiring practices? What do you mean exactly?
So I can talk specifically about our hospital. We started workforce development opportunities in 2017. We've helped to fund a low-income housing tax credit project. That the bottom space of that LIHTC project is workforce development space that the hospital uses. And so we reach out through community connectors to get community residents trained to work in the healthcare space. And so I think about 1.5 years ago, our hospital promised a minimum income of $15 an hour. And so we know when we're bringing people in, they're going to make that $15 an hour. But beyond that, we're also looking at their second and third job and getting them the training to like become an STNA or more, so that there's a trajectory of them moving throughout the hospital with higher pay.
That's awesome. So again, it's thinking about individuals. The more money they make and the less money they have to spend on housing, the more money they have to spend on other necessities, like taking care of their health and food access and all of those kinds of things. That's amazing. Thank you. Diane, you touched earlier when you talked about the Healthy Beginnings at Home program, you talked about the state budget. So can you expand on that a little bit more?
Yeah, so specifically for that initiative.
Yes.
Yes, so currently we have, I think it was in the governor's proposal. One of the line items within the Development Services Agency, we have a portion of it. So this is how the the budget is like. You're in here, part of a larger thing, part of a larger thing, part of a larger thing. But we have a line item in there, part of a line item to expand the Healthy Beginnings at Home program. It doesn't specifically say Healthy Beginnings at Home, but it's the wording is basically that, the replication of the research, the study to improve maternal and infant health outcomes. So, and I don't have the figures off the top of my head, but it is really, it is a roller coaster, as anyone who goes through kind of the budget process knows. At each stage of the game, you're waiting to see, when the omnibus amendment came out yesterday, did it get increased? Did it get decreased? Did it get cut? And so, there's a lot of nerves there, but, we think that even, we would like to get even more money so that we can continue to work with all the cities that we have begun relationships with for this replication. If that doesn't happen, I think that we still have other opportunities, and I think that's where kind of these partnerships come in. Is okay, well, yes, there's this federal funding out there. Can we get a portion of the American Rescue Plan dollars? We are doing a series of webinars with the different cities for the replication, and one we just finished yesterday was on financing. So who should you be engaging in your community? If we get the money, if we don't get the money, whatever happens, who are those organizations and people that you should be reaching out to? What are the talking points? What are the roles that everyone's playing? How do you get them on board with this thing? So it is a long-term strategy, but I think everyone, like you said, has a role to play. And I think I was thinking a little bit about different people's roles, and foundations especially. I think that's a big one for any kind of pilot activities. There's only so many organizations, right, that have the ability to have kind of flexible funding and aren't looking for a huge ROI or like certain impacts. So especially for these pilot type things, which we are still a little bit in that area with health and housing, they can be a really key component because they may be more willing to put money into something more experimental than some other partners. So I think that's definitely key to engage. So I know I kind of went in a very circuitous route with that budget question, but I think it starts with the budget, but it really all comes back to those other partners as well. And I wanted to add to for just to emphasize, I guess, the point of everybody's roles and different partners, just acknowledging that everyone is different and everyone has very unique knowledge. Okay to say as an organization or an individual or a team or whatever, like, we don't know anything about this. We need your help. You know all about this. Like, let's work together. Everybody has something to bring to the table that's important, and we have to have other people to make these things work. So I think there's sometimes reluctance to partner up and collaborate, but I think acknowledging that is very important, and figuring out like, okay, where can we fill the gap? Can we offer services or pay for things that other people can't? It's just very strategic. And the other people I'm just rambling now. I wanted to mention, other implementation partners that might be needed aside from, the obvious that we mentioned. we can't forget about property owners, homeowners, landlords. I think that's one that, you know, wasn't necessarily mentioned, but especially in terms of any of these things being successful and sustainable in the long term, we have to make sure that we are getting buy-in, that it works for them, and we're getting their buy-in to make sure that these things are sustainable.
Definitely. Thank you, Diane. And I would definitely engaging those folks. And I would also add, you know, those folks that are experiencing the challenges themselves. So those that are experiencing the challenges around health, and making sure that we include people with lived experience also is critically important as we try to develop solutions. I want to go back to something, George, that you mentioned very early on in the discussion, when you talked about kind of those 3 key things to focus on when you're thinking about housing. And the one you mentioned was advocacy. And so I've heard that kind of inferred and implied and weaved throughout our discussion thus far. Can you talk a little bit more about advocacy efforts and what role that plays in changing our housing situation?
Sure. You know, I think there's 2 components to that advocacy piece. The first is you know, goes around specific pieces of legislation. You know, whether it's the, you know, local, federal, one of the federal legislation, for example, that Bon Mercy is trying to get behind and get all of our, you know, partners, especially those that are representing us, you know, in the Senate and the House, is the Tax Credit Improvement Act. Because that's been teed up for many years, and this might be an opportunity to get that passed. Obviously, for those that aren't familiar, it increases, for example, just one thing it does is increases the allocation of tax credits by 50% per capita for all the states. So that would be a dramatic influx of capital. It's not the kind of thing that you know, traditionally health systems had tried to take a front seat on or be more active on. But I think the most important part of advocacy goes back to a point that you made in responding to some of the things Diane was talking about, which is, you know, the folks in the communities. And that's where healthcare is uniquely positioned, because we already have direct relationships as healthcare providers with end users, or, you know, recipients of service, however you want to describe folks, and we also have commonality because we're all consumers of healthcare. So whether we're a provider in this conversation, in the next conversation, we may be a consumer. But I think that's one aspect where we in the healthcare industry have the opportunity to continue to learn from the community development industry. Like, for example, time-honored traditions of things like asset-based community development, some of the organizing principles behind that. Really, and now with the Affordable Care Act being, you know, we're several years into the Affordable Care Act, and the community health needs assessments, you know, we're going through our 3rd and 4th iterations of that. And we're starting, if you didn't see it in the beginning as a healthcare institution, if you haven't started seeing the social determinants emerge as priorities with your communities, you may not be connecting with the right folks. And there's the opportunity there. And what that gives us an opportunity to do collectively is work on new ways to convene these conversations, and new ways to sort of codify or sustain, you know, new models of how we you know, identify, prioritize, address, you know, issues and problems and opportunities. So from an advocacy standpoint, we have the opportunity to work between industries, and you know, maybe try to loosen up some of the strictures that exist today. You know, Diane was you know, talking about some of them. You know, certain money can't go for this, other money can't go for that. You know, we're part of an effort. You know, Gretchen and the folks at National Children's are involved in it, as well as a few other health systems, called it Accelerating Investments in Healthy Communities. It's a Robert Wood Johnson sponsored initiative that has convened health systems that have already done something in affordable housing. And one of the participants is Boston Medical Center. There's a physician there named Megan Sandell who has really thought out housing as vaccine, meaning that, you know, if we could get to the point where providers could write a prescription for better housing, and some of it is based in the research does have to happen, but at a certain level, we all know that policy is not always based on research. So we need to advance the research, but we can also advance the will of the folks affected to, you know, to better affect the common good. And I think that's a tremendous opportunity here. And even though, once again, sometimes it takes a global pandemic to really have us focus, you know, housing stability is impinging on everything in our nation right now. So that's a really tremendous opportunity.
For sure. You hit some really great points there, and we could spend all day again talking about all of these things. One of the things you mentioned, community health needs assessment. So, you know, here in Greater Cincinnati, we're right in the thick of data collection, and expect that report will come out later this fall. So really interested in seeing what that report tells us, but more interested in seeing how we utilize what that report tells us to restructure and refocus our efforts on those topics that have been identified by the community. And how do we then leverage, as you mentioned earlier, those community benefit dollars to support those areas as well. So we've got about 5 minutes for some Q&A. There were quite a few questions that were entered into the chat, and unfortunately won't have an opportunity to reach all of them. But I do want to pull out one that talked about specifically CareSource and the results the data that you're seeing. And you shared some of that data here on the call. And the question is, are you able to share that data publicly so people can have an opportunity to look at it?
Yes, the data that we have, at least for Healthy Beginnings at Home, we can share that publicly. And we do have a website with a number of different presentations for that initiative, along with a number of reports. So right now we're kind of in the, you know, evaluation stage. So we've had several different reports for healthcare outcomes, but also we just posted the report for housing and economic outcomes. And then we also kind of have a policy evaluation for the program. So I'm going to put this in the chat, hopefully, the website where those reports are located. And this is the website of a consultant we're using. So that's why that's there. But that will have a number of those different reports with a much more detailed explanation and listing of all those different data points and outcomes.
Great, thank you so much. All right, we're gonna transition a little bit. Unfortunately, we're not gonna be able to get to all of the questions that were entered into the chat, but hopefully we'll still have some opportunity to discuss some of those topics. I do wanna say thank you to our panelists. We're gonna end this portion of the discussion. Thank you all so much for your time today and for sharing all of the great work that is happening, and then also talking about what the opportunities are for us to continue and strengthen this work. At this point, I'm going to turn it over to Kristen to talk to us about transitioning to the next portion of today's event.
Great, thank you, Kiana, and thank you to this wonderful panel. This is a really great conversation. Lots more to dig in on. So with that, we want to invite our audience to engage a little more with us in that kind of conversation. So if you want to discuss with the group something that you heard that was interesting, maybe ask another question, please use the raise hand function, which should be available to you in the sidebar, to raise your hand and indicate to us that you'd like to jump in and engage with our panelists. We'll bring you up into the conversation here so we can all see and hear you. And maybe, Kiana, while we wait for folks to raise their hand, if we want to work through some of the other questions maybe that we had from the audience, if there are still a few outstanding, as a way to sort of keep things going while we wait. Don't be shy, everyone, please join us.
Sure. So here's one that's related to the housing choice voucher, which has provided part of the solution for our housing crisis. And there's an acknowledgement that it's been increasingly difficult for people to find quality housing that would accept the vouchers. And then also the housing stock that charges rents that the voucher program pay is not the best quality. It's deteriorating, unfortunately. And so people are not able to really leverage and make use of that voucher. So the question is around any of the panelists engaged at the federal level trying to impact what comes out of HUD?
I can't say we've been involved at the federal level, but we have been involved at the local level. The City of Columbus City Council just passed legislation about source of income. So landlords can no longer discriminate if you have a voucher. And so I think there are several cities in the Central Ohio area who've passed similar legislation. And so if that's a concern, happy to provide more information about what we recently passed in Columbus.
That would be great. It's a huge step in the right direction for sure. Thank you for that. One other question, and we touched on this a little bit, but how are hospitals and healthcare systems capturing the health outcomes specifically related to housing? So are there specific key metrics and things that hospitals are tracking in order to understand the health outcomes on housing specifically?
So we are still kind of exploring this and building it, but we are actually kind of working on some of this project right now, actually connecting our member data with the members that have been a part of some of our housing initiatives, and then the date of those interventions, and then to be able to see those health outcomes. But as a managed care organization, I know that we have member data for a ton of different health related metrics, and so we are able to see those on that individual level, and the changes as well. And something to note here too, just because I think if you're not in the healthcare world, you don't really, I didn't know exactly how all these things worked. But specifically for us as a managed care organization, we, for example, with Medicaid, we get paid, Gretchen mentioned the capitation rate, which is, so we get a certain dollar amount per Medicaid member. But at the same time, we also have these what are called quality withhold metrics. So we don't get certain payments to us unless we show that we have achieved certain goals related to individuals' health. So we have gotten this many people to do their diabetes testing, or this many people that have achieved this weight loss, or decreased the rates of asthma for this segment of the population. So once we achieve those things, we get those additional funds. So there is that kind of direct incentive for us to meet those outcomes and improve the health of our members.
Sure, thank you. You're just kind of describing some of the payment reform that we're seeing happening across the country, and thinking about shifting from the traditional fee-for-service model into a pay-for-performance model, where you have to show impact and have to show improved health outcomes in order to get that reimbursement and to get paid. So a great way to be able to show the impact of some of those interventions.
Thank you to Kiana. Thank you to our wonderful panel for this conversation today. And please follow up with us via email should you have any further questions or want to know more. We're always here to help the conversation going, and we hope you'll join us at our next webinar later this summer. So thank you all very much and have a great day. Thank you.
Thank you.